Have you ever forgotten someone's name and then remembered it 5 minutes later? Most people have. And that's actually very different from dementia. Welcome back to Workday Lessons. Yesterday we talked about the myth that forgetfulness automatically means dementia. Today, let's talk about the difference between normal aging and memory changes that deserve a closer look. Because as we get older, some changes are completely normal. For example, it may take a little longer to remember a name. You might occasionally misplace your glasses. You may walk into a room and forget why you went there in the first place. We've all done it. The good news is that occasional memory lapses happen to people of all ages. Now, here's where things become more concerning. It's one thing to forget where you put your keys, it's another thing to forget what keys are used for. That's a different conversation. Concerning memory changes often start affecting everyday life. For example, someone may ask the same question repeatedly, get lost in familiar places, have trouble managing bills, struggle to follow conversations, forget important appointments regularly, or have difficulty completing tasks they've done for years. Family members often notice these changes before the person experiencing them does. Now, here's something I tell patients all the time. Memory is not just about the brain. Sleep affects memory. Stress affects memory. Depression affects memory. Certain medications affect memory. Even hearing loss can make memory seem worse because the brain isn't receiving information clearly in the first place. That's why we don't jump straight to dementia every time someone reports memory concerns. We look at the whole picture. Now, let's make this practical. If you're occasionally forgetting small things but living independently, managing your responsibilities, and functioning normally, that's usually very different from the memory problems we worry most about. Now, here's the key point. The question isn't simply, do I forget things? The question is memory affecting my ability to live my life? That's where the conversation changes. Now, quick reality check. If memory problems are becoming more frequent, worsening over time, or affecting daily activities, don't ignore it. Talk with your healthcare provider. Early evaluation often provides the most answers. If you found this helpful, save it, share it, subscribe, and follow for more workday lessons. Simple health, clear answers, so you can understand memory changes without unnecessary fear. I'll see you tomorrow. Don't just live, thrive.